Let me come to the other critical part, and Dr. Mahajan, I want to bring you in, vaccine related. You know, many people are saying they are getting infections after the second dose, whether they are taking Covishield or Covaxin. Are we now very clear that we cannot, that the vaccines are not conferring immunity, and therefore, if are we clear about that, doctor, in the first instance?
See, the vaccines are giving immunity. It is that, you know, we cannot be 100% certain that they will prevent infection. They do not prevent infection. They reduce your chance of getting infection. People are getting infected, but the advantage of the vaccine is that by and large, people are not getting moderate or severe disease. They are not needing to be hospitalized, and they are not dying. You know, those who are getting severe disease are only an exception, maybe 4 or 5%. So the vaccine is very, very important, but you have to follow COVID appropriate behavior so that you don't get infected.
But can I ask you this, doctor, and this is linked, Dr. Mahajan, to this. This is very important. If I have tested positive for COVID, how many weeks after recovery should I take a vaccine? So if I've taken the first dose and I get COVID, how many weeks later do I take the second dose?
See, the US CDC says after 90 days, you know, and in our country, the recommendations, days. Yes, yeah. 90 days, because they say you have immunity in any case for 90 days that we know. In fact, it may extend even to 6 months. So the US CDC recommends having your first shot or second shot after 90 days, but there are different regimes being followed by different people, even in our country.
What's your recommendation?
90 days.
90 days.
You're recommending 90 days. Should I, and I come to another big question, doctor, Dr. Mahajan, should I test before I take the vaccine? I could be asymptomatic, go to the hospital, take the vaccine, and maybe become a spreader. So should I test before I take the vaccine, particularly because the vaccination center could be crowded, Dr. Mahajan?
That's not recommended, number one, Rajdeep. Number two, you would already, you know, our system is overburdened for testing. We would unnecessarily be testing. And number three, follow COVID appropriate behavior, wear a double mask, and hopefully the vaccination centers will follow COVID appropriate behavior and distancing, and they would not be crowding. But there is no recommendation and no need for getting an RT-PCR test done before going and knowing whether, even if you are asymptomatic and you get the jab, it doesn't interfere.
And linked a final question to that, Dr. Mahajan, should I do an antibody test a week or so after having taken both doses to know that I've got sufficient antibodies?
That's futile, Rajdeep, not recommended anywhere except for certain specific situations. And it doesn't matter, because in any case, we get, you know, good immunity after 2 weeks of the second jab. And whether you have a low antibody or a high antibody, I mean, people think it's like money in the wallet. It's not, because that is not the only thing which is giving you immunity. There is also a cellular response which is responsible. And even if you have low antibody levels, the T cells will come into play, they have memory, and they will generate antibodies as and when it's necessary. So really, no need to get your antibody test done.
Okay.